In the heart of Pakistan's Sindh region, we began working with a group of young individuals who are taking the lead in driving social change. They are breaking barriers and challenging norms to promote sexual and reproductive health within their communities.
Adolescents in low and middle income countries like Pakistan face immense barriers when it comes to sexual and reproductive health. In communities where these topics are still taboo, they are left in the dark, denied the basic knowledge about their own bodies and rights.
With the aim to advance sexual and reproductive health among adolescents in this rural region, our team partnered with youths within the community who would lead the change and become sexual and reproductive health rights advocates. These youth champions underwent extensive training on topics such as puberty, contraception, STIs, gender-based violence, research methods, and how to approach these conversations. After receiving training, they learned to navigate sensitive conversations with respect for cultural values and were tasked with inviting youth in their neighborhoods to participate in awareness sessions.
In Pakistan, it's usually difficult for adolescent and young people to discuss about reproductive health with their communities or even in some cases with their parents. So in this context, we have devised a platform, community space in rural communities where these young people, adolescent boys and girls, utilize these spaces in a community sensitive way.
Youth advisors faced resistance at many points: misinformation, stigma, and deep-rooted cultural taboos. Parents were worried about what their children would be taught in such sessions. Community leaders were skeptical, seeing these sessions as a challenge to traditional values.
As youth advisors, we encountered significant fear and resistance when addressing sexual and reproductive health in our communities. It was seen as something taboo, especially in rural Pakistan, where traditions are strong and change is often met with hesitation. We listened to the concerns of our elders, community members, and peers and cousins, relatives related to sexual and reproductive health issues among adolescents. We also changed our ways of educating young people on sexual and reproductive health issues.
These youth champions gained community trust. They empowered their peers to take control of their sexual and reproductive health. They maximized the participation at community level and dispelled misconceptions through awareness sessions.
In our sessions, we emphasize gender equity and empowerment, encouraging boys and girls to play their part in building a society. Our aim is to equip them with the knowledge to make informed decisions and understand their rights.
As trust grew, so did participation. New sessions were held, reaching more and more young people. The number of youth champions expanded from 6 to 15, each one more committed than the last. With each session, the ripple effect grew stronger. More adolescents, more parents, more community leaders began to see the value of these conversations. They aren't just champions, they are trailblazers, building bridges between generations and bringing a new narrative of health and empowerment to their communities. The movement was no longer just a project. This is what happens when young people take the lead, when they are given a voice, a platform, and the right support. Imagine what more they can do. Together, let's build a healthier, more empowered future for all.